Welcome, everyone. We are happy you are here. I don't know if we did the awkward silence of a minute of trying to wait, but really you're watching us and talk among each other. Welcome. We are here today at the end of a long day, and I hope you enjoyed your sessions so far and look forward to another full day tomorrow. We are with my awesome colleagues, Deb Perry, Lisa Hepburn, and Jordyn Rand, and they'll be sharing just about their work at the Center of Excellence for Infant and Early Childhood Mental Health Consultation, and just the session of their title. It sounds kind of scary, but it's really valuable work. I've definitely used some of the tools and resources on our website and found that when you really sit with it and break it down, it's very helpful. So building a theory-driven evaluation of IECMHC. And Jordyn's going to be awesome in giving the resources in the chat, the CoE Tips and Tools. And so I have a script here that I'm just going to roughly pull from. The session is being recorded. Transcription is available through the Zoom platform. And should you have any questions, please feel free to relay questions in the chat. And I don't know, you can share if you want them to come off mute or not, Deb and all. But we also want to let you know that before we begin, the views, policies, and opinions expressed in this presentation are those of the authors and not necessarily reflect those of SAMHSA and HHS. So I will pass it off. Lovely workshop to my colleagues, Deb, Lisa, and Jordyn.
Great. Good afternoon, everyone. I had predicted that we would have more speakers than participants, and so y'all have already exceeded our expectations. So thank you so much for joining us at the end of a long day. I'm Deborah Perry, and I am the Director of Research and Evaluation at the Georgetown University Center for Child and Human Development, and also for the Center of Excellence for Infant and Early Childhood Mental Health Consultation here. I'm joined by my colleague, Lisa Hepburn. I'm going to let Lisa introduce herself, and then we'll have Jordyn introduce herself, and then we'll get started.
Hi, I'm Lisa Hepburn. I am the lead evaluator at the Center of Excellence, the group who's hosting this conference. And also I work at the sister center, the Technical Assistance Center for Infant and Early Childhood Mental Health. Jordyn?
Hello, everyone. My name's Jordyn. I'm the project researcher for the Center of Excellence, and so I assist these wonderful people, Lisa and Deb, with all things research and evaluation for our center.
And we're very lucky to have her. So what we wanted to do was, since you guys exceeded our expectations and we have more people than we expected, we would love it if in the chat you wouldn't mind just putting a few things about yourself. So the good thing about Zoom is that it already says your name. But what is your role? What role do you play in your infant and early childhood mental health consultation system, program, adjacent system or service? And where are you doing your work right now? So city and state, tribal nation, whatever you feel comfortable sharing with us. We just want to get a sense of kind of who's in the room. If we were in a real room, we would do that in a different way, but we'd just love to know a little bit about who's here. And because we are a relatively small group, I also would love to see if you all have like specific things that you came here hoping to learn or talk about. We're very flexible. And we would love to make sure that this really meets your needs. And so we have an agenda, but it's incredibly flexible. And so Jordyn is going to help us monitor the chat and kind of help us, try to make sure that we're meeting your needs. The primary kind of organizing principle for this session is that as a Center of Excellence, we have actually built a really robust set of tools for folks who are interested in research and evaluation for infant and early childhood mental health consultation. And we want to showcase some of these, and we want to make sure that you know what they are, and we want to answer questions if people have looked at them and wondered about something. And so this is kind of the agenda that we had planned for you guys. As I said, we would love it if you want to interject. We would love this to be more conversational than, one-way conversation, but like whatever you guys are comfortable with, because we're here for you. So we want to make this work for you. So we're going to run through some of these things, and then we're going to save some time at the end for dialogue and discussion. We know that many of you are here because you want to learn from each other, and we really want to hear from you and learn from you as well. So to the extent that we can do all that in 50 short minutes, let's go. Let's get started. One of the tools that we have developed most recently, and Jordyn is going to be like our chat bot. I guess that's actually something else. She's going to be the person who shows you where everything is on the website. And so she's going to put links to the resources as we talk about them. So one of the more recent tools that we have is something that we call advancing the evidence base for infant and early childhood mental health consultation. You'll see that's a theme here. One of the things that at the Center of Excellence we really want to do, and we're really committed to doing, is helping you all know kind of what is out there in terms of evidence for this intervention, but also how you can contribute to building that evidence base. And this particular tool kind of organizes the types of evaluations or research and evaluation projects that you might do based on different goals. So I think as at a conference on equity, it won't shock you that that's our first goal here, that we want to make sure that we're reaching all of the people who could benefit from the intervention. And we also want to make sure that that people are using, reliable and valid tools as part of their practice. The tools that they're using are culturally, linguistically appropriate, and that folks are using data internally to kind of make sure their program is the best program it can be. Oh, that was exciting. The second goal was actually, is the program working? And I think that obviously is very straightforward. We're doing hopefully pre-post kinds of assessments. We're gathering evidence to see what kinds of changes happen for children and families, for teachers, for home visitors at the program level. I think we're also, for goal 3, interested in really understanding kind of some of the equity-based issues. So for whom is the program working, some of those kinds of things. And then ultimately, and not everyone is going to want to get all the way to this end of the continuum, we would love to have more replicable models of mental health consultation that would be available for folks to scale up in different parts of the country. Those of you who do a lot of work in the home visiting space know that we have quite a robust list of evidence-based home visiting models that are kind of off the shelf and you can get trained in them. And we don't have that same kind of opportunity in mental health consultation. So that's really the 4th goal. Jordyn, anything in the chat I need to respond to before I move on?
No, I'm just taking notes on some questions we can get to in our discussion later. Perfect.
Thanks so much. The next resource that we have is actually basically a template, a fill-inable template that we created so that folks could create their own evaluation plans. Some of you are SAMHSA grantees, and so you have a launch grant or you have an IECMH grant, and there are specific kinds of guidelines you have for federal reporting and evaluation plans, but many of you are doing this work in without that kind of structure, and so we felt like it would be really helpful to put together kind of a table of contents and some sort of chunks about what makes a good evaluation plan. And you can see here, this is just the cover page from that, but if you go to the link that Jordyn put in the chat, you can scroll through and see kind of all the other components of that that we outlined for you guys. So for me, probably the most important starting point in any research or evaluation is really a well-articulated theory of change. And a lot of times people ask me kind of, what's the difference between a theory of change and a logic model? One way I think about that is the theory of change is the arrows between the boxes on a logic model. They kind of explain the how and the why an intervention is working, sort of the mechanisms through which we think our activities are leading to certain changes, and then ultimately longer term outcomes. And a lot of times we'll do that with sort of a visual representation. Other folks have done really nice ones that are a set of words. We have some examples on our website of different ways that people have articulated theories of change. And then we also developed one for the Center of Excellence. And I'm going to take a little bit of time going through this in just a second, but what you can see is sort of when we think about mental health consultation in the center, those orange boxes, that's where we really are describing the activities and the approach to the intervention. And we think really about the direct effects being on the consultee, right? But many of us spend a lot of time measuring outcomes that are more indirect at the child and family level, at the program level. And what we want to make sure people remember is that all of that is somewhat dependent on what people are bringing into the relationship, because we do believe that mental health consultation happens in the context of a relationship and with, of course, supportive reflective supervision. So one of the things that we did as a CoE activity is that the research and evaluation team, at that point, we had Kayla Titus, who's now off in a doctoral program at UVA, working with me and Annie Davis-Schock. And we and others reviewed all of the journal articles that we could find that were looking at outcomes. And then we mapped which part of the theory of change the articles actually were shedding light on. And we ranked them on a 4-point scale. I think Jordyn was able to put a link to that actual paper into the chat. It is open access, so folks should be able to read the full paper. I'm going to just go through it really quickly right now and give you kind of the high level points for that. Again, because I think it points to where we need folks to be contributing to the next body of evidence for mental health consultation. So starting at the right-hand side with the indirect effects, this is where we actually have the most evidence. So I would tell you that at this point, we don't need more studies of whether mental health consultation helps children with externalizing behaviors. We have really, really solid evidence of that. We also have a lot of evidence that that mental health consultation improves children's social skills and social emotional development, and also is very effective at preventing expulsion. Those are the things that we know very well, we know it very clearly. I will say all of that we know in the context of early care and education. We have much, much less data from other settings. So folks who are working in home visiting, early intervention, primary care, child welfare, anything other than ECE, we need you all to step up and do those studies and help us build the evidence base in those spaces. I think what we don't have good data on is internalizing. So we know the squeaky wheel gets the oil. Kids who are quietly sitting, in their childcare classrooms don't come to the attention of the teachers and don't often get referred for mental health consultation. So that's an area I think we have less data than we'd want on impact of disparities that manifest in ECE, and also less data on parent and family voices. In terms of the other piece of indirect effects, we've got a lot of data on the quality of classroom, climate, center quality, but again, less data on program level disparities and changes that might happen in terms of policy level changes when folks are working programmatically. Next in our theory of change is direct effects on the consultee. And again, here we've got good data, especially for teachers, on changes in self-efficacy, changes in knowledge, teacher-child relationships, but we haven't done as much work in terms of mechanisms, so mediation analyses. We haven't disaggregated data by race and gender, and there's a lot of other constructs that could still be measured that we would like to encourage you guys to contribute to. Here's my favorite part of the theory of change, because in a lot of papers that we read, people were saying, and then we did mental health consultation. And that's not enough anymore. We really need to know a lot more about dosage, so frequency, duration, intensity. We need to know, back to the green part of the theory of change we're about to talk about, who is doing the mental health consultation. We need to know a lot more about the activities of consultation, and we've done some work on that at the CoE as well. The extent to which people can more carefully articulate the what they're doing of consultation, as well as the how, which of course is our consultative stance, which Khadija, I know, spoke to today at the plenary in the middle of the day. Those are things that we need a lot more work on. We have almost no data on the consultative relationship or consultative alliance, in part because we don't have good measures of that. And even though we all know and believe that it's within the context of a consultative alliance, that the work actually, that's where the magic happens, we have very little data that really looks at that deeply. And shockingly, we have almost no data on the role that reflective supervision plays in supporting mental health consultation, the parallel process, all the things that those of us who have been doing this work for a long time walk around in our hearts knowing absolutely is some of the critical non-negotiable elements of good consultation. We have very little studies to support that. So really want to encourage folks to get out there. Again, some of the problems there are measures of these constructs. So we need some good measurement studies too. And then lastly, we have the participant characteristics. So consultee and consultant background characteristics. What are they bringing into the relationship? And for the consultee, something that we call readiness for consultation, which I think people don't always know exactly what we're talking about, but you kind of do, you know it when you see it. So how ready are the consultees to engage in the relationship building, the trust building? How willing are they to consider doing things differently? And then we have, of course, the embodiment of the consultative stance on the consultant side. So the extent to which that consultant is ready to show up in their role as a consultant and not as a clinician or a therapist, which is often how people have been trained. Again, we got almost no measures of these two constructs, even though we think they're really, really important in determining what happens on the other side of the theory of change. So need a lot more work in development of tools for that. And then we've got some emerging findings in terms of consultees characteristics. So, you know, less experienced teachers sort of benefiting more from consultation. We need a lot more work in that space. And then also, a lot of us believe that consultant training probably makes a difference, but almost nothing out there in the peer-reviewed literature that tells us much about that. I'm going to hand it over to Lisa in a minute, but I just want to underscore sort of what the takeaway here is. We know a lot about direct and indirect effects of mental health consultation, but almost all in early childhood education. So we have a lot more to learn in other settings. And we know very little about how mental health consultation impacts disparity. So that's a very strong part of our equity agenda. And we just have a lot more to learn. And that's what researchers always say right at the end of a study is future studies should look at, but we want you to take up that mantle and help us fill in some of the gaps in our knowledge. Lisa.
All right. Thank you, Deb. Again, welcome everybody, and feel free to drop some questions in the chat as we go. You know, we work as a team at the Center of Excellence, and I really feel like our role is to be your support team. You know, that's kind of what we do is, that's why I see my role. So today, what I wanted to talk a little bit about is, you see this nice little diagram that we have here on the slide. This is what we have on our website, and we've kind of color-coded ways for you to access information that we have on our website for research and evaluation. And so what Deb already spoke about was that lighter orange, develop a theory of change and logic model. That's where you can look and find some of those resources that Jordyn put in the chat. I'm going to talk for just a few minutes about the next one, number 2, the bright orange, explore the evidence base. And I'll just touch on the blue one, selecting the measurement tools. So the way I think about this, and Deb, if you don't mind going to the next slide, is how are these are ways that we can help make your job easier. That's what I was thinking about, is that we have multiple resources on our website, and it can help you from going down that rabbit hole of Google when you just need to get some information and you don't know where to start. So I'm going to suggest you start with the Center of Excellence website, and especially when you have a question. So I thought maybe the way to kind of walk you through this was to give you a case example of how if I was going about this, how I might use these different tools that are on our website. So let's say you have started using mental health consultants and mental health consultation with a home visiting program, and it's going pretty well. And now you're thinking, well, I think I need to maybe measure its effectiveness, or I want to see, has it been implemented correctly or effectively? And maybe you want to do this because you're going to try to expand your funding. You need to show some funders, how well it's going, but where do you start, right? So obviously you're thinking about your theory of change, as Deb mentioned, but then you might need to find some of those research papers or some of those published reports about how, let's say, mental health consultation, home visiting. So the evidence synthesis, and Jordyn's going to kind of pop these in the chat as we go so you can follow along. I think the evidence synthesis is a great, if I can say it correctly, synthesis is a great tool and a great place to start, because this is kind of where we have a comprehensive summary of both the evidence for mental health consultation in the peer-reviewed literature, as well as kind of the gray literature. So it's where we've looked through evidence and summarized it in a couple different ways. We've organized it by outcomes, by mechanism for change, by populations and settings. And it's about a 3-page document. You can go there, you can get a great kind of summary, and everything has citations with it. So let's say I'm going to read about home visiting, and I need to figure out, has it been studied very much? What are the research papers written about it? I can go and I see actually there's not a whole lot that's been published about mental health consultation and home visiting, but I see there's a few citations. And looking in the bibliography there, you see it looks like a couple journal articles, maybe, and there's also a evaluation report for the state of Illinois. So now I have some information. I've gotten my background. All right, so there's some evidence. but I'd like to read a little bit more about those papers that I just saw in that citation. I would then go to the annotated bibliography, which is also right there on our website. What we did with the annotated bibliography was provide you with a resource for folks who may not have access, which is most people, to full text journal articles. So the annotated bibliography is a great place to look up peer-reviewed literature. It gives you, what we've done is used layperson language to create a very good summary of the article, as well as include the official abstract from the journal article and the full citation. So you might just, that might be all you need. You might, even if you're writing a background for, or writing a summary for a funder, you could, if you don't have access to getting that full text article, hopefully we've been able to give you really good information through the annotated bibliography. Okay, so now you've picked up a few articles from the evidence synthesis. You went and read their summaries in the annotated bibliography about home visiting and mental health consultation. But one more place to stop before you go is the searchable evidence database, which is another place that we've created a way for you to look up evidence for mental health consultation in peer-reviewed literature that might not necessarily be research articles, but might be descriptive articles. It might be reports. It might be policy papers. You can search it multiple ways. If I was using this example, you can search by setting. You can search home visiting and see what comes up. And again, it gives you summaries and links to those articles. So now you're feeling, all right, I have a pretty good base of knowledge. I've found out what's there. I've been able to do this all on one website, which I think is terrific. And then you remember, oh yeah, there's that evaluation report that I saw referenced in the evidence synthesis. I think the evaluation reports are a tremendous resource. They are also listed right there on our website, and our friends and colleagues have shared their evaluation reports with us. You can get executive summaries, and often, as you all might know, evaluation reports are multiple pages. They're filled with detail. They're filled with information about what tools, what measures folks have used in different settings, in different situations. In this case, the state of Illinois did an evaluation that included home visiting. So I would pull up the state of Illinois. I'd probably read the executive summary first, and then I'd see, oh, look, they tried this, they did this. It's a great framework for, it often will include their theory of change or logic model as well. So these are great places, I just think, to kind of start to simplify finding resources, because as we all know, we can go down Google and even Google Scholar, and you're going a bunch of different directions. We've tried to simplify this. We've tried to consolidate it and kind of be your clearinghouse for all of this information. So I just want to touch on the next slide just to also mention what we have in terms of looking for measurement tools. So the, Deb, if you don't mind just switching to the next one, it just shows our, oh, there it is. Oh, there we go. This is a screenshot of what it looks like on our website, which is our choose and use measurement tool finder. So you can search two different ways. It's one of the most frequently asked questions we get at the Center of Excellence is, what tool can I use to measure X, Y, or Z? I'd start here. This is a great place to begin. It's got, you can search by the domain or maybe the outcomes. You want to look at, I want to look at teacher-child interaction. Start there. Or you can also search by name. So let's say in one of those research papers that you just looked at, you saw that they used a specific tool. You can, make a note of that, come back here and search for that tool by name. And these are tools that are validated and that have been used in at least 2 evaluations. So that's kind of our standard for what gets placed on there. And when you pull that up, it will also tell you how you can access that tool. Is it free? Do you have to pay for it? Different information. So you're not just getting the name of the tool, you're getting information about how it's used, the cost associated with using it as well. So anyway, I just, I sound like a salesperson, I think, for our website, but I do think we have been able to hopefully simplify and consolidate, like I said, and feel free to continue to reach out to us if you need help using any of those resources we've placed there. And now I'm going to turn it over to Jordyn.
Thanks, Lisa. And good afternoon to everyone. So For these last few slides, we're excited to talk a little bit more about the next generation of research and evaluation in this field, and just kind of explore some of the latest advancements in the field that really do a great job at centering diversity, equity, and inclusion in their work. So earlier in this session, Deb had mentioned that, I guess just how important it is that moving forward, we have evidence for consultation's impact on reducing disparities and how we can kind of tease out more of that theory of change. And one way we can move in that direction is by disaggregating our data, or breaking the data down into subgroups, such as, for example, gender or race, age, socioeconomic status, disability status. I'm sure there are many other subgroups we can think of. But the reason why it's important to disaggregate our data is, again, as Deb mentioned, rarely do interventions or programs work the same for every single person who receives it. So we know that some may benefit more, some may benefit less or not at all. And when we disaggregate our data, doing that allows us to look at the big picture, but also at some of those nuances that can sometimes go hidden or concealed when we only look at the full or aggregate data. I want to highlight Harvard's Center on the Developing Child, who developed this ideas impact framework in response to this challenge, where often, as is the case with consultation, we have evidence for improved outcomes. We may know that it works, and we may even know a little bit about how it works, but often we're really missing that piece about for whom does it work and in what context does it work. And so I'm going to include this link in the chat for you all. But this framework is just a really powerful tool and kind of thinking beyond the traditional approaches to consultation, or program evaluation rather, and really trying to push the needle in that direction of equity. And if you want to take a look at this figure below, an example of how this applies to consultation comes from Shivers and co-authors 2021 study, where they wanted to look at how consultation was effective in reducing disciplinary disparities. And in this study, they really prioritized disaggregating data by race and gender. And because they did this, they were able to come across some really interesting findings regarding consultation's outcomes, as well as its effectiveness for a minoritized group, that being Black boys. And this information, again, it could have been hidden or concealed if they had only decided to look at average numbers or the aggregate data in full. So if you take a look at this image, figure 1 from their study, you can see that the solid line is representing Black boys and the dotted line representing white boys. Over a 12-month period of working with a mental health consultant, teachers actually rated their conflict with their children as much lower than when they had started. And what's even more interesting is that after these 12 months, the levels of teacher-child conflict between teachers and Black children, or specifically Black boys, were even lower than their white peers. I'm also going to put this article, or a link to this article, in the chat for you all. But again, this is really just a small window into a great study and a great example of what data disaggregation is in the context of consultation, and how it can have really just significant implications, not only for advancing the field, but also for improving outcomes for the communities that we work with. If you want to go to the next slide, Deb, thank you. So in summary, today we've discussed several areas to consider when we think about this next generation, or the future of research and evaluation. Lisa had mentioned earlier the importance of measurement tools, and that we have new and better validated measurement tools. Also, that we expand our research to other understudied settings, such as home visiting, for example. And Deb had also discussed why it's important to establish a fidelity measure so that we can concretely define consultation. I'm going to include another resource for you all in the chat. This link will take you to a resource on our website. And this comes from a consensus building study that we did a couple years ago to help just identify and establish the essential activities of consultation. And I believe tomorrow there will actually be a session going over some of the findings from this report, if you want to look for that in the attendee hub. And then lastly, because equity is a central component of consultation and because it is the topic and theme of this conference, we just wanted to give a quick shout out to Oregon, who, when designing their statewide consultation program, they really place an emphasis on centering the needs and the perspectives of people of color. So looking at children, families, and providers of color. And I will also put this here for you all if you want to take a deeper look. 1 second. There we go. But this link will just take you to their full report, which summarizes the information they collected and some of their design and implementation recommendations for having an equity-focused system of consultation. And with all of that being said, you can go to the next slide, Deb. I believe now we want to move into a time of dialogue and discussion. I was monitoring some things we saw in the chat, some questions and comments from people, but again, we'd love to just hear from you and hear what your needs and your priorities and your questions are. So.
Yeah, thank you so much, Lisa and Jordyn. Jordyn, I'm very impressed that you can talk and put things in the chat that's like, you know, higher order level than many of us can. I really am thrilled that at almost 5 o'clock, we still have almost everybody who joined us at the beginning. So just want to thank people. If you guys are going to drop off, we really appreciated you showing up and being here. I thought some of the things that Jordyn shared with me that were in the chat, I think we were able to get to a number of those. Specifically, I know Sarah Heel was interested in kind of outcome measures for home visiting. And so I was able to share some of the state evaluation reports that Lisa was talking about. But we would love to open it up if anybody wants to unmute themselves and chat with us. We are here. We're going to be here for a few more minutes. And if you're done for the day, thank you for coming and come back anytime. Reach out to us. We have ways to request individual consultation to programs. I think that might be on our last slide. Is that right, Jordyn? Yeah. So
yes.
If you connect with us in other ways, we are here anytime you need us. So stop talking and open the floor up for dialogue and discussion. Yes, the slides will be posted in the in the attendee hub. All those links.
And the recording as well later.
And you can save the chat if you were excited about all the great links that Jordyn put in there. Easy to save the chat before you go. What can we do to better support you in the last few minutes we have?
Or any other tools or resources, maybe not mentioned here, that you all find valuable in your work.
Yes, or something that you've developed that you'd like us to put on our website, because there's that too. Thank you, Whitney, for being with us this afternoon.
Also, if anybody has ideas for resources they think would be helpful to the field, we are all ears. So we love to get suggestions for developing things that you think would be helpful, so that you can send emails to us or thoughts of, you know, maybe something you've seen in other work that you think, wow, this would be really helpful. So like I said, send it our way.
Yes, we put Lisa's email on this final slide so she can be the recipient of all of the good ideas and bring them back to our team. Yes. So Dawn, are you asking that question of us, or are you asking it of the people who are with us?
Can be anyone.
Yeah, I mean, I think best practice for developing a theory of change is that you do it alongside program folks and folks with some evaluation knowledge. In New York City, we actually had all of the consultants in a room as alongside the program managers, and we really broke it down into those different boxes and had them really talk about how they think what they were doing was making a difference at different levels. And I think those processes can be really powerful and can really elevate the common elements of mental health consultation, as well as the really unique things about a program. I see that Carla asked about measurement tools or resources to guide the tracking of IECMH referral processes. And I'm really interested in that question, Carla. Would you mind coming off mute and just saying a little bit more kind of about the context of that question, so we might be able to better answer it?
Sure. So I'm doing consultant work. I'm very, very new to this. So I just started like in September. And I know that part of the process of consultation is referring to different community resources. Primarily for where I work for a child and adolescent trauma center in Pittsburgh. And so a lot of the referrals are like mental health referrals. But we are still trying to figure out our process for like tracking referrals and like reaching out to if it's clients who we no longer really have contact with, like we gave the referral, but we still need to kind of track what happened with that referral. So we're still in the process of trying to like get the details of that like figured out. So I don't know. I know that's kind of like a very open question, but that might just be because of my like newness. And
no, I don't think it's because you're new at all. I think it's a really important question, and I wonder if other folks who are on the call who have had a chance to kind of figure that out for themselves might want to chime in, because I think it's a really good question. I think what we know about consultation is it's not treatment, right? And so if you are identifying children who could benefit from additional direct mental health services, having a way to connect them to those services. And as you said, if they're no longer in the childcare program or no longer in the home visiting program that you're working with, how do you kind of stay connected and make sure they're getting what they need? I think it's a really important question. And the short answer is we don't have any like validated tools or approaches for that. It's really something that each program kind of develops on their own, depending on the resources in their community, depending on their relationship to those community-based resources. I think it's a very kind of idiosyncratic part of the work. I saw my friend Lauren Rabinowitz was on the call. Is she still here? Would she like to weigh in at all on Carla's question?
I'm looking, I'm not sure if she's still here.
Jordyn, can you remind me at what point we're supposed to close down our conversation here?
2:10 Pacific time.
I love 2:10. Yes, thank you for relaying that in Pacific time. All right, so we've got about 6 more minutes. Other questions, comments, conversation? Would love to hear Anything from anybody who's still left? Anyone speak to Carla's question? Gets bonus. If we were in person, I'd be giving out chocolate right about now. So we'll have to figure out some kind of virtual chocolate. Yeah. Sarah's asking all the tough questions today. So I think one of the, if you guys haven't seen in the chat, Sarah Heel is asking about tools for measuring reflective capacity. I think many of us think that that is one of the elements of the secret sauce of mental health consultation. And one of the reasons it's so important to have reflective supervision available for the folks who are delivering consultation. And there are not great validated tools for that, but there are a number of folks who are working in that space. We had the opportunity to talk to somebody. Where were we, Jordyn? We were in a conversation with someone.
Eastern Michigan University.
And they were working on some tools for that. I know our very own Sherry Heller, who is one of our technical assistants team, developed something called the Purpose, which she did as part of her 0 to 3 fellowship. I mean, the short answer is that it's a really important construct that we don't have well-validated measures of, but that shouldn't stop us from trying to measure it. So Sarah, if you want to follow up with us, we can show you what we have. But we're really at the beginning of that conversation in terms of kind of research and evaluation. Lisa, anything you want to add?
No, I think you said, I do think it is an area, though, if folks are interested in talking more about it, I think it's probably be something maybe it'd be fun if we pulled people together who are all working on these tools and, host something that's kind of a mini collaborative where people start kind of sharing best practice and best ideas. But as Deb said, it's an area that has obviously, I've heard a lot of interest lately.
Well, especially as folks move into doing this work more in a home visiting space, I think we have to develop a set of tools that are more appropriate to that setting and to the way that work happens. So it does sound like there's some good interest in them. Melanie is saying it would be nice to have something accessible to measure the impact of reflective practice. Yep, absolutely. Something pre-post. So I think those are some areas where we as a Center of Excellence can pull some resources together and put them back out to the field and draw on where people are doing this work well. I do think the Illinois people did a nice job of looking at the literature. The team there is from Chapin Hall. They have a very strong, long history of doing really high quality, rigorous work. So standing on their shoulders, and also Beth Green, who is one of the folks who is involved with the Oregon work. She's done some work on mental health consultation in home visiting through one of their project launch grants. So there's some places there we could look. Other questions, comments, opportunities for dialogue? I'm going to stop sharing my screen. See if there's anybody left here that wants to chat us up the last minute that we have. Again, super grateful for all of the folks being here late in the afternoon. Happy to continue the conversation one-on-one or in small groups. please reach out to us. You have Lisa's email. You can also go to the Center of Excellence website and make a TA request. We stand ready to help you advance your work, grow the field, and there's a third verb that I can't remember. Grow, advance. Should be on the background. Impact. Thank you. Thank you, Carla. You want to join the CoE team? Thank you, everybody. Hope to see you at something tomorrow when we have our last day. Oh, thank you, Jordyn. Yeah, TA request form. Okay.
Thank you, everybody.
Lovely to see everyone. Thank you, Dawn.